So as you know, recently Donald Trump and the Republicans passed their new tax and budget bill, and there's been a lot of talk about real-world cuts to healthcare. And I want to talk with you about this because it's an extremely important issue. It affects people's lives immediately, and let's jump right in. So this was actually from Market Watch. So in the financial news, nursing homes may start sedating your elderly parents and eventually you because they don't have enough workers. And the first thing that came to my mind is I know a lot of immigrants work in the healthcare industry, be it nurses, right, nursing homes, these kind of things. And I was just unaware of this kind of practice. A basic gist of it is when the staffing is low, you're going to sedate more patients because it's easier to take care of them. This comes from a study actually at my school, Penn, and it says, first, do no harm, do staffing shortages drive abuse and malfeasance in the U.S. nursing homes? And this is more in the article because that was the question, right? So if you don't have enough people, does that change the way you do things? It says about 24,000 additional nursing home residents will be sedated just to keep them under control as a result of the defeat of the Biden administration's staffing mandate. Okay, so basically, you know, Trump's trying to roll back anything that Biden did. The chances of your parent or grandparent being subject to so-called, quote, chemical restraint by nursing home staff is about 10% higher than it would have been if the staffing mandate had survived, according to a new analysis. This is more here from the study. As they explain, quote, patients placed under chemical restraints require less work. Reducing workloads rather than fulfilling them, nursing homes can hire fewer nurse staff while utilizing antipsychotic medication to still manage their patient load. They find that nursing homes run for profit are most likely to resort to such chemical restraints to control residents. I mean, logically, I understand how and why these things happen, but I'm not in this industry, so it's not something I was aware of. And just being aware of it today it's really disturbing. If anyone works in this industry, I want to hear your thoughts on this. Or if you have family members who have been affected by this, I want to hear. I'll just say this, my actually wife, so you guys see Yeji on the channel, her grandma is in a nursing home, and we've noticed that her health has deteriorated, mostly because she doesn't get out for walks as much as she did before. And it's a tough situation, because when she was living by herself, she fell down, and then after she fell, that might have been a year or two ago, the family decided to put her in a nursing home because it's someone to take care of her like 24/7 kind of thing. But I mean, I can't speak to the quality of my my wife's grandma's nursing home. I'm not involved with that stuff, but I'd said this is what I've heard because I saw grandma recently, and just she didn't look as good as she did before. And it just makes me wonder, like, this kind of thing, if they're just giving her lots of sedation drugs essentially. I don't know. But essentially, if the staffing levels are the way that they're going to be with Trump kicking all the workers, right, and threatening people, I think it's going to get worse. That's why I mentioned this. And even clinics are going to close down. And I know this is not a fun topic to talk about, but I think it's a very important one because, again, it's going to affect people's lives of what the Trumps and the Republicans are doing. So, for example, many people always say, you try to talk to your MAGA friends and family about this, but they don't believe it. But the effects are going to happen, like you're going to see it immediately. So, for example, this is in Nebraska. It says a clinic blames its closing on Trump's Medicaid cuts. Patients don't buy it, right? So a clinic saying, hey, we're going to be closing, but there's like Trump people are like, oh no, it's all lies, right? But it's like literally they're going to have an effect to them soon. A clinic in rural Nebraska has become a political flashpoint after tying its looming closure to Trump's law-cutting Medicaid. So let's read the details of this stuff, and this gets you into the kind of the personal interaction that people have, and you get involved with personal beliefs. But facts don't necessarily care about your beliefs. Like if something's going to close because the money isn't there, they're going to close. So Curtis, Nebraska, this is a small town. I think it's like 800 people, something like that. The only health clinic here is shutting down. And the hospital CEO has blamed Medicaid cuts in President Donald Trump's signature legislation. But residents of Curtis, a one stoplight town in deep red farm country, aren't buying that explanation, right? So this is kind of the MAGA stuff where the people just don't believe it. They're just like, oh, you're just playing politics. They'll say that kind of stuff, or they watch Fox News all day and Fox News just tells them that everything's fine and they're all going to be rich, that kind of thing. And it's frustrating, right? Because I really know. That's why we do stuff every day. Here's a quote here. It says, anyone who's saying that Medicaid cuts is why they're closing is a liar. That's coming from a person named April. She saw over lunch at the Curtis Area Senior Center. So someone went down there and talked to people at the senior center. And there's a description of it. The retirees trickling in for fried chicken and soft serve ice cream will be hit hardest when the clinic closes this fall, right? Seniors who sometimes go in multiple times a month to have a blood drawn will have to drive 40 miles to the next nearest health center. Sick people, she worries, will put off checkups and get sicker. And this is the effects of what's going to happen with under Trump policy, right? If more clinics close down in rural areas, people have to go farther to get any sort of care. And as you get older, you need more care, right? You guys know this stuff. And it's sad because like these people, like we can see these problems coming. And that's something I always mention is always be prepared in life and understand these things, right? Even if it's uncomfortable to talk about, you just got to talk about the reality of the situation. And for anyone who's ever, had family or friends with healthcare issues, you guys know how sensitive these topics are, where some people are really stubborn in their beliefs, but you're just like, sometimes you got to sit down and just tell them the truth. Like, hey, this is the money situation, right? And in this example, hey, the clinic's closing. And it's weird that people don't believe it or they don't believe the real explanation. It's frustrating. Trust me, I really know. Arriving for lunch, retired Navy veteran Jim, another person named Jim, said he'd read an op-ed that, quote, tried to blame everything on Trump, right? So anytime you bring this stuff up, they're just like, oh, you're just a Trump hater and blah, 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 right? You guys know how these conversations go. And that Jim says, horse feathers, right? He said, dismissing the idea. I know, I laugh, but it's frustrating. And guys, I really know. If anyone who has Trump people in their life, you'll know too. Curtis has become an early test case of the politics of Trump's agenda in rural America, where voters vulnerable to Medicaid cuts in Trump's One Big Beautiful Bill law are reluctant to blame the president or congressional Republicans who approved it, right? So even though their healthcare centers getting cut, right, they don't want to blame Trump like that. They'll come up with some way to blame Biden or something, I'm sure. Many people in Curtis have directed their frustration at their local hospital system instead of their representatives in Washington, right? So there's gonna in this situation they'll blame the CEO in the hospital. Why you close it down? And then you're just a Trump hater, that kind of stuff. And this is where it's hard to communicate with these people. But I'll tell you what's going on. Democrats and healthcare advocates are pointing to the town, population 806, so it's a small town, in the last census as a first casualty of Republicans' healthcare overhaul. Bernie Sanders and others have referred to the town on social media as a model of what's to come for rural hospitals around the country. Close to half of rural hospitals nationwide already lose money. It's in terms of dollars and cents, it's just not profitable to put a healthcare clinic in a small town, right? It's expensive to run this kind of thing, and you may not make a lot of money, but not everything in life has to be about making money. And that's something that why you want public assistance for healthcare, why, as a nation, you want to say, hey, we've decided that it's a priority for us to take care of the elderly. For some people, right, in the other camp, the Republican camp, they'll be like, well, no, it's more important to give tax cuts to billionaires so they can build their AI robot factories and build their rockets and explode and go to Mars. And no, seriously, that's the stuff they talk about. I know how it sounds stupid when I talk about this stuff, but that's, if you watch it, because I watch stuff all the time on the financial news, that's their whole plan is we're going to, give all these cuts to people like Elon Musk, because I guess Elon Musk is poor and I guess he needs those tax benefits, and then suddenly the money will somehow trickle down to you. But I mean, these people in like these small towns, they're facing real ramifications of Trump's policy today. Their healthcare facilities closing, and this is sort of why you want to have a nationalized system, because then wealthier places will help subsidize poorer places. It's reality. If you just go to hey, we only take care of our own, I don't care about other Americans, then yes, some people in rural areas will get hurt. And so it's sad because like you try to talk to them and try to help them, but they just, and the Trump people, it's the way they kind of think about humanity. And if you understand how the Trump family thinks, they're raised to believe that they're better than everyone else. They deserve more. They don't need to pay taxes or anything like that because they are productive Americans and they're awesome. That's sort of the Trump psychology. And then for whatever reason, MAGA people worship that kind of stuff. I know it's a weird cult and it's frustrating to talk about, but you know, it's sad because like I want to make it clear I don't you know, hate anyone who's American. I actually want the best for them. I actually want them to have a healthcare. I want their, you know, to be healthy. I want their families to live, you know, healthy lives. I want, you know, your grandma and grandpa to be okay. I think that's a reasonable thing to say, and I want a fair system. But it's sad though. Close to half of rural hospitals nationwide already lose money, and analysts expect Trump's tax and spending law to add more strain. Here's more. Community Hospital, the nonprofit that runs a clinic known as Curtis Medical Center, and a couple of other facilities in the region plunged into the national story when it announced on July 2nd, one day before the bill's passage, that a confluence of factors had made its Curtis outpost unsustainable. It can't do it anymore. It cited years-long financial challenges, inflation, and anticipated federal budget cuts to Medicaid, the public health insurance program for lower income and disabled Americans. And Trump was also saying he was going to put tariffs on pharmaceuticals. I think it was like 200% or something crazy like that. So costs are unfortunately going to go up. But this whole thing is a long-running policy of how Trump thinks of people, essentially just doesn't care. So for example, this was also the news today. ICE memo outlines plan to deport migrants to countries where they are not citizens, right? So if the USA doesn't have good relationships with a country they want to deport someone to, be it like a Cuba or China or wherever, they're just like, well, you don't belong in this country and we can't send you back to your home country, so we're just going to send you anywhere. And so that's when it was in the news before, and I saw it and I wasn't sure what to make of it, where Trump was trying to convince countries in Africa actually to take undocumented workers. I mean, the whole thing is just, it's a crap show. I mean, there's a way to put it. And some of these people have been in the USA, say over 10 years, things like that. I mean, it's really, really ugly. This whole thing is ugly, but it's again, a whole sort of milieu or culture of the Trump of how they treat other people, right? And how they think about other people. Here's more. Trump is gutting weather science and reducing disaster response, right? Again, as long as you can get the tax cuts and privatize as many things as you possibly can, that's sort of where that's going. Give, you know, Elon Musk the weather satellite contracts, right? So Musk is interested in that kind of stuff, or other buddies of Musk. And, you know, cut as much stuff as you can. Or this, NOAA defends policies amid reports FEMA didn't answer thousands of flood survivor calls, right? You guys see what's going on. Is Trump's dismantling our safety net. And what's frustrating is, you know, when they bring NOAA on TV, she'll say whatever nonsense to, you know, trigger the MAGA people. So say, oh, you know, anyone who wants to nationalize or supply support to rural hospitals or have FEMA services, oh, they're all communists, right? That's literally what she'll say. She'll say that kind of stuff. And you know, there's people in, I guess, small towns in like, say, Curtis, Nebraska, in this situation that eat that stuff up, and it's sad. And unfortunately, this is going to be the end result. Their hospitals are going to close. They're going to have to drive farther. And will they ever, you know, blame their dear leader Trump? You know, who knows? In this situation, it looks like they're still not doing that. But, you know, regardless of what those people believe, I think there's still going to be just realistic and, you know, pragmatic people out there who want to hear the truth. And that's what I try to give you guys every day. So please be careful out there. This is the world that we're going into. My advice is just, unfortunately, this is how it is. It's, you got to take care of yourself, and don't let anyone tell you that everything's great. I mean, like, if it's not, right? Don't people tell you, oh, you're going to get the best healthcare ever, even if your place is closing. Like, you will know your own situation, and sort of what I think is important is just deal with reality in regards to healthcare, money, or any kind of these things. So I do appreciate your time, everyone, and I'll catch you all in the next video.